Male circumcision is the surgical removal of some or all of the foreskin from the penis. Several types of research have documented that male circumcision significantly reduces the risk of HIV acquisition by men during penile vaginal sex. Compared with the dry external skin surface, the inner mucosa of the foreskin has less deposits of fibrous protein, a higher quality density of target cells for HIV infections, and is more susceptible to HIV infections than other penile tissue in laboratory studies. The foreskin may also have greater susceptibility to traumatic epithelial disruptions, in other words, tears, during intercourse, providing a greater portal of entry for pathogens, including HIV. In addition, the microenvironment in the preputial sac between the unretracted foreskin and the glans penis may be conducive to viral survival. Finally, the higher rates of sexually transmitted genital ulcerative diseases, such as syphilis, observed in uncircumcised men may also increase susceptibility to HIV infection. Lack of male circumcision has also been associated with sexually transmitted genital ulcer disease and chlamydia, infant urinary tract infections, penile cancer, and cervical cancer in female partners of uncircumcised men. The latter two conditions are related to the HIV infection. Transmission of this virus is also associated with lack of male circumcision. A recent meta-analysis included 26 studies that assessed the association between male circumcision and the risk for genital ulcer disease. The analysis concluded that there was a significantly lower risk for syphilis and chancroid among circumcised men, whereas the reduced risk of herpes simplex virus type 2 infection had a borderline statistical significance. When deciding to circumcise their babies, a lot of people are concerned about the risks associated with male circumcision. Reported complications depend on the type of study, the setting, the person doing the operation, patient's age, and the surgical techniques or instruments used. In large studies of infant circumcision in the United States, reported inpatient complications range from 0.2% to 2%. The most common complications in the United States are minor bleeding and local infection. Some people think that circumcising a baby will make it have less penile sensation and perhaps not as good sexual function when it gets older. Well, well-designed studies of sexual sensation and function in relation to male circumcision are few, and the results present a mixed picture. But taken as a whole, the studies suggest that some decrease in sensitivity of the glands to fine touch can occur following circumcision. However, several studies conducted among men after adult circumcision suggest that few men report their sexual functioning is worse after circumcision. In fact, most report either improvement or no change. Some people object to the cost of circumcising babies, but a large retrospective study of circumcision in nearly 15,000 infants found that neonatal circumstances is highly cost-effective, considering the estimated number of averted cases of infant urinary tract infection and lifetime incidence of HIV infection, penile cancer, and many other problems that come when a child is not circumcised. The cost of postnatal circumcision was tenfold the cost of neonatal circumcision. Many parents now make decisions about infant circumcision based on cultural, religious, or parental desires rather than on health concerns. In an effort to reduce the spread of HIV, public health officials are considering the promotion of universal circumcision for all baby boys born in the United States. The move comes after officials analyzed the results of several studies that show in African countries hit hard by HIV, men who were circumcised reduced their infection risk by half, according to the New York Times. However, those studies focused on heterosexual men who are at risk of getting HIV from infected female partners. The main issue in the U.S. is men who have sex with men. In 2008, the CDC estimated that more than 56,000 people were newly infected with HIV in 2006, which are the most recent data available. Over half of those new infections occurred in gay and bisexual men. The other half occurred in straight people. Critics of the recommendation say it subjects newborn boys to medically unnecessary surgery without their consent. But I ask, if it can potentially save their lives, is it medically unnecessary? If it can stop them from spreading diseases to other people, is it medically unnecessary? Any step that can stop the spread of HIV must be given serious consideration. We have a significant HIV epidemic in this country, and we really need to look carefully at any potential intervention that could be another tool in the toolbox we use to address the epidemic. There would definitely be a benefit for infants from infant circumcision, and that benefit far, far, far outweighs the risk. Some people have raised ethical objections to asking parents to make decisions about elective surgery during infancy, particularly when it is done primarily to protect against HIV and STDs that don't occur until young adulthood, but others have found it an appropriate parental proxy decision. And I'm going to tell you what, baby boy, I find it an appropriate parental proxy decision. I know you. I know who you're going to grow up to be, and I know when you get older, you're not going to go do the medically necessary thing to protect yourself and cut off a little part of your penis because you're afraid and you don't know what the results are going to be. So I'll tell you what, baby boy, I'm going to make the decision that may very well save your life. I am your parent, and I am your proxy, and while you can't object to it, I'm going to do it. And anybody that doesn't like it can eat my shorts. And if you don't like it, you can eat my shorts too, baby boy. But I'm keeping you alive any way I can because I'm your mother and I love you. As Sam says, all her baby boys will be clip cocks and schnip schwanzes. It's non-negotiable.